Hi there. So my nurse told me that you have really severe upper stomach pain. Is that true? Okay, well we definitely want to get that figured out. Now, how long has this been going on? 2 to 3 years? Wow. Okay. And I see you were in for this about 6 months ago, is that correct? And the pain's only gotten worse? Okay. Well, what it looks like we're gonna have to do is place the tube down to your stomach so that we can view with a microscope to see what's going on in there. To, in fact, make sure you do have ulcers and to make sure they're not perforated and causing internal bleeding or something life-threatening like that. So we will need to do that minor surgery first before we can start operating for real, okay? We have to know exactly what's going on. And unfortunately, there's no real way for us to tell whether or not you have ulcers with just a simple CT scan. They're trying to come up with a better way, but right now the tubing is what we really have to do that, okay? And have you got a chance? I know we sent you to a referral to have this done a few months ago. Did you ever get it? You didn't get a chance to go yet? Okay. Well, we can definitely make an exception and do that for you here just because you're in such debilitating pain. I will go ahead and prescribe you some pain medications, and then we will get you on some sedatives so that you won't be awake during this procedure because it is a bit invasive, okay? All right, thank you. So, no heavy alcohol consumption, okay? Any use of aspirin, ibuprofen religiously? Yeah. You do take ibuprofen? Okay, yeah, it's probably best to switch to Tylenol or something less stressful on the stomach, but we can go through all that later. So no smoking, no, okay. Alright, well, I am gonna go ahead and get some of your vitals real quick, if that's okay. Is that okay? Okay, just 1 minute. And I will be doing the procedure that inspects your stomach. The anesthesiologist will be in here, and then I'll be the one actually orchestrating the procedure. Now, I won't be doing the emergency surgery if we determine that they are in fact ulcers that need to be removed, okay? All right. So let me go ahead and put on my gloves. Just relax. Take deep breaths. There we go. Got to get those gloves all good on each and every finger. Each and every finger. Pull them up like so. And we'll do the next hand. And while I'm putting on these gloves, I want you to take some really deep breaths, okay? Just close your eyes and try not to think about it. Are you still having those pains as of now? Okay. I am going to also feel around on your upper abdominal and your back as well, okay? Okay, so let me start off by feeling around your abdominal, okay? I want you to lay back really long for me, arms down at your sides, and I'm just gonna go ahead and feel on your upper stomach. Now, let me know if it's painful. Okay? Is that too painful? Okay. Alright, it does feel like the location that ulcers usually So I am going to go ahead and try to feel around with my stethoscope as well. Okay. I'm going to feel around the shoulders and the back while pressing on your abdominal. Okay, so I've got some more handy information there. Let me sort through my papers. That. Okay, I'm gonna go ahead and write down some of my findings. Pain in back of shoulders, correct? And left abdominal. They'll want to see this for sure. Okay. Now, let me go enter this in our records again. 1 second. Just relax. Okay. Looks like the anesthesiologists are actually on time today. So what we're going to do is we're just going to take the time to really prep you, get you ready for this minor procedure, okay? Okay. So, what we need you to do is just continue to take deep breaths. Once the anesthesiologist is in here, I'll go ahead and be at your side during that as well, okay? I'm just gonna go ahead and get prepped, because I will be performing the procedure. Yeah. Is it getting more painful? I know. Don't worry. We're going to make sure that you won't be leaving us without the issue taken care of, okay? But you're doing the right thing. I believe getting this all looked at and having the answers once and for all is going to be your best bet, okay? Now, I am going to, can I take your temperature real quick to see if you have any fevers before we start the anesthesia? Okay, perfect. Go ahead, say Okay, perfect. Let's see what temperature comes up on here. Okay, so you do have a bit of a fever. Okay, that shouldn't be a problem. Let me just enter it into our system. Okay. Alright, now I am going to change into my surgical gloves since I will be operating on you. Okay? Alright. Just continue to take deep breaths. We really need to get this figured out today because we don't want internal bleeding or anything like that to show up. Here. Oh, and here's the anesthesiologist now. I'm going to be right here by your side while they administer the medication, vitals looked good. He has a slight fever, but I told him there's nothing to worry about. I'm going to pull them over my sleeve. This is actually my second procedure like this, so I'm kind of excited. procedure won't take long at all, I promise. Okay? Okay. Do you have any last minute questions? No? Okay. Alright, you're gonna be fine. You're gonna be fine. Okay. Let me check his heart rate. Okay. I think he's asleep. All vitals look good. Okay. Let me go ahead and go get the tube. There we go. I'm going to sit closer. I'm going to get it. Okay. So here's the tube. Okay, here we go. Prop his mouth open. I'm going to slowly put this in while being able to place a mirror on his stomach. So gently put this in. Okay, go. Doing very well. More. Okay, just a few more inches. Alright, that should be good. Gonna sever that off. And now I'm just going to view in here. And I'm going to pull the images up on my screen. Okay. Alright, I think I've got both the images that I need now. Yep. Okay, I'm going to take this back out of his throat and gently. Perfect. I will sterilize that later. Alright. So, I'm going to go ahead and close his mouth back down. Going to rub some petroleum jelly on the surface so when he wakes up it's not all sore. Okay. So, let me see. Yeah, those images do look like ulcers. Okay. Hi! You did so well in the procedure. It was lickety split, no issues. But unfortunately, well, fortunately, because now we know what the issue is, you do have a couple of ulcers in your upper stomach lining, and one is actually beginning to rupture. Now, we didn't see any internal bleeding yet, but we want to do this surgery as soon as we possibly can so that you don't have internal bleeding, okay? So now that we know for sure that you've got some ulcers, we don't need to do a CT scan. We don't need to do a sonogram, nothing like that. We're going to go ahead and wheel you back over to the operating room. You will be put under full anesthesia for that procedure. And that procedure should take around an hour, hour and a half, okay? They're going to remove you coughed. That's okay. You did wonderful. Okay? Alright, so we will wheel you down to the main operating room. They're ready for you. And actually, our anesthesiologist for that should be in lickety split. Do you have any questions for me? Oh, no. You shouldn't have any issues with being sedated twice in one day. No. you so much. You were such a great patient for me today. Okay, you're halfway there. Okay. All right. And once they come in, you'll be good to go. Well, I won't be going down there with you this time, but I will say that usually after ulcer operations, 1 to 2 days in the hospital, depending on how you're healing. But you as the end person, I'm sure you'll be out of here in no time, okay? Now, is there anybody you'd like us to call? A parent, a sibling? Are you sure? Okay. All right. Well, you did so good today, and you caught it in time. That was really good, okay? All right. Bye-bye. I wish you all the